There you go. And welcome everybody to the Unify meeting on June 8th, 2022. And I know we had a break last week, but I'm glad folks are back here today again. And so welcome everyone to today's call. I think we have a pretty focused agenda after some basic introductions. Or I think a few people, at least one person I know is on the call, new person. So we do a little introduction. Then I'll just do just a couple updates. There's some interesting things happening across the proverbial pond, and then at ONC. And then we're going to turn it over to Brian and Paul and Eric to talk about OKN and the exciting stuff that's going there, since it really aligns closely with the consent work that we're talking about. So I see one participant that says iPhone on it, so I don't know who that is. I could guess. If you could identify yourself, so I can just put a name in there.
I'm guessing it's me, Rob Longley.
Oh, okay, Rob. Okay.
I'm driving, so.
Okay.
It shows up a little different.
So we can either refer to you as Rob or as iPhone.
Yeah.
glad you can make it. We do have another guest, Marianne Schutzman, who I would welcome to our group here. We just had actually a really interesting conversation earlier. We've known each other for a while. So Marianne, this is the crew I was referencing that we've been meeting for a while. So our tradition here is just to welcome new people, just say a few words about where you're from, what you're doing. But I was really delighted to learn about some real amazing connections here, particularly in New York. So welcome to the group.
Thank you. Hi, Kathy. And I see Paul's here. And Daniel and I go back. So I'm so glad, I'm delighted to be a part of the group. In our discussion, I run a center at the mayor's office at City Hall for Health and Human Services. And we do data analytics for Health and Human Services here at City Hall. So we do basically the administrative data we use to answer pertinent questions and to help the commissioners and folks along. Sometimes we do big reports, and we did just finish up a report that's on our line about foster care and high school graduation rates. So we sometimes do those kinds of advocacy documents and documents that will help the mayor focus on a certain issue, which in fact Mayor Adams is now doing around high school graduation rates and with foster care kids. So those are the kinds of things we do. So glad to be a part of it. I'm really interested in this topic. And this is something that's near and dear to us in terms of our work. So thank you very much, Daniel, for the invite, and nice to see some of you who I know, and nice to meet some who I don't.
Yeah, welcome. It was great. We just were having a torrid conversation, and Marianne said, "Oh, do you know anything about this Be Inc. project?" And I was like, "Oh yeah." So unexpected connection. So I'm glad I figured if Kathy was on and others here, you would connect. So that's great, because it's a lot of the analytical stuff we're talking about, and a lot of consent work in particular. A lot of it sits on Kathy's shoulders at the brunt for you. So established relationships are great. Just a few updates, and if others have updates, that would be great. I know this morning, Dr. McCoy and Jim St. Clair were in Hamburg, and they were presenting at the European Social Network. And I heard from them. They had a packed house, which was great. And what Jim said, actually both Jim and Kathy said, was that during the opening plenary session, they had sort of open questions to the leadership there, and there were several around privacy and consent. And so Alfonso, who runs that, basically said, "Well, those are great questions. Make sure you go to the session." So it was great call out, and I think really good participation from a bunch of different countries, and I'm sure they'll come back next week or a week after and give us a good update on things. So unfortunately, we were not able to join in by virtual. So and unfortunately, Mickey, more than anything, he had pre-recorded a welcome, which actually we can post that. And Amanda, we can post that on the site if anyone's interested. Kind of an overview of ONC to the European social network, which kind of represents most of OECD, and both at the state level and the local levels. I think there were folks from the World Bank there and lots of other places. So he gave his intro, but he wasn't able to participate in the discussion because of I guess, for whatever reason, technically they were doing simultaneous translation in a couple languages, so they couldn't work it out. So, but he did participate, and which is great. Have a federal voice in the conversation, which is terrific. So that's one thing that has it's happening. The other thing I wanted to mention is that we had a conversation last week with some of the ONC folks around the August 16th consent workshop that appears to be moving forward. I have not yet seen an actual announcement from them. They said it might be out sometime this week. So I haven't seen it yet, but when we did speak to them, they said that was happening. And we're going to learn more on Friday, kind of what our various roles will be as a community and individually or as collectively in terms of presenting on consent and the work that we're doing with Unify here. So I suspect next week we'll have a bunch more information about it, but it was a very engaged, very interesting conversation, and ONC is certainly highly motivated. Seems like they're moving smartly in this direction, so I'm really excited about that. And then the last note I would make, we still haven't, well, two quick notes. One is we're still waiting to hear from the CDC Foundation about their interest and level of support for our work going forward, and hopefully that we'll get some more information about that, maybe as early as this week. And then finally, one of our other potential partners in Hennepin County, which is Minnesota, has stepped forward. I've been working with them for a while now, and they have gotten alignment within their organization all the way across the whole county, from the top of the county through the hospital systems and stuff. And they sent us a commitment letter to be a proof of concept site. So they're if you're familiar with Hennepin, you'll know that they are very they've been on the long march, the interoperability long march, for many years as well, and are an integrated county and are well thought of in terms of doing this kind of systems work and coordinated care. So I'm excited to hear that, and we'll be inviting them to these calls as well as we go forward and start to do more planning with them. So those are my updates. Let me just open the floor if anyone has stuff that is of breaking news or interesting stuff that you want to share. You can do that, and then we'll turn it over to Brian.
I have a quick announcement.
Yep.
So OpenSea Labs, we trained our first users at the New Jersey Integrated Care for Kids project last week, which went really well. And Gravity recently did a spotlight on us on our use of various standards around clinical and social determinants of health referrals, spotlighting both May-June and OpenSea Labs and the interoperability work we're doing. So I'll post that blog post in the chat.
Great. Thanks, Matt.
They like us. They really like us.
That's New Jersey?
Yes.
Excellent.
In Gravity project.
Well, and Gravity and ACL.
The
ACL.
rest of the ground. That's super to hear. I'm glad that that's moving forward well. And I hope we can hear more about that as it progresses and see some stuff. I know I haven't seen Dave lately. I'm hoping that, with the work that they're doing on their mobile app for assessments, we can kind of, again, look at that and see how that applies to the work we're doing on consent in the near future here. So with that,
we're very happy working with May-June.
yeah, that's great. That's great.
They're a great group of folks and very interesting technology.
Well, that's great to hear. I'm certainly hoping we can build on that, especially their knowledge of ink and the complexity of all these various systems that are trying to do stuff together. So we'll encourage that going forward. So with that, I just a couple of announcements. We have some meetings coming up over the next couple of weeks. We have next week, we don't have a specific topic, but I suspect we'll talk more about ESN and then also focus in on the consent workshop when ONC talks about that, informs us about that. The following week, we'll have the Center for Democracy and Technology, we partnered with on our presentation to the Data Funders Collaborative. And they bring both an education FERPA perspective to the table, but do a lot of work with ethical data sharing and the Office of Civil Rights and stuff. So Elizabeth Laird will come and present a little bit to that. And then following that, we'll have the Civitas presentation about their work on the health data utility. And so we'll dive a little bit more into that. I heard that in California a couple of weeks ago, and Kathy is updated me a little bit on the work that's going on with Civitas as well on their conceptualization of a data utility. And I think it'll probably be useful to at least be aware of what they're doing, no less sort of try to synchronize a bit with what they're doing in this area. So, Kathy, I don't know if you have any other comments you would make on that at all, but feel free.
Nope, not at the moment.
Okay. So, so with that, let me turn it over to Brian. Brian, you're going to kick off and sort of present the OKN stuff, give a little background for new folks, and share what's going on here.
Yeah,
Thanks.
let me, let me just get my screen shared here and find out. Okay. Thank you, Eric. I will skip over the NEAM slides when I get to them and let you do the standalone NEAM thing afterwards. Is that okay?
I don't see if you're showing them yet.
No, I was having a side conversation with Eric.
Aha, okay.
My apologies.
No problem.
So now you should see a community care slide.
Yes.
First off, I should preface this by saying this is in essence a working group status report from the user stories use case working group, the ontologies working group, and the consent technologies working group, which you'll get some sense of as we go through this presentation. We've got about 30 some odd slides. My apologies. I should yield first to Paul. Paul, did you have some slides you wanted to present?
No, I'm just going to talk a little bit.
Well, why don't you talk a little bit and then I'll get into what it is we presented today.
Yeah. Brian asked me to sort of introduce this discussion by bringing everybody up to speed about how we got to this point. And Marianne, I want to welcome you to these meetings. I'm happy to have you here. You're certainly on the front lines of a lot of the work that we talk about doing in Stewards of Change. This whole project is really getting to be pretty fascinating. It started off, the National Science Foundation has been working for several years to build what they refer to as an open knowledge network, which is in their minds, a very large network that's available to the public, even with data and all kinds of things. And so they funded pilot projects for a couple of years to the tune of $5 million for projects to build prototypes, basically, on how to share information, all built around the new technology of knowledge graph technology, which is not yet in the mainstream of a lot of state and local organizations, but it's catching on pretty fast, according to the Gartner Group. So National Science Foundation wants to continue this. And what they did at the first of the year was to reach out to the federal government agencies that they work with, all of them, I guess, and ask for use cases to be proposed that could be good use cases for developing this open knowledge network. And I have this job now as a volunteer to be the co-chair of the NIEM, National Information Exchange Model Tiger Team for state, local, tribal, territorial agencies. So I got tapped to lead this response from the NIEM perspective. And of course, I reached out to Daniel and Brian and Eric and said, you know, what do we got to offer? It was really interesting because National Science Foundation only got 13 use cases proposed, and 5 of them came through the NIEM channel. And there were, you know, Brian did a masterful job of dealing with the various issues of decarceration and the consent model. And Eric chimed in on homelessness stuff. And we proposed, among other things, that taking the entire National Information Exchange model and turning it into a true ontology that followed the standards of RDF and OWL and became something that could be the basis of knowledge graph technology for all kinds of domains. And the NSF got all excited about that, but they also got excited about the other use cases that we presented. We included one on criminal justice, which we got the Bureau of Justice Statistics to endorse. And then the rest of them came out of the work of Brian and Eric. So we really, we kind of dominated the whole contest from a NIEM perspective. And the NSF was very grateful, and they got very excited about some of the use cases. So that's what kicked this off. And then they engaged in a 6-month sprint, really, a 5-month sprint, where we had meetings monthly to talk about these use cases and try to flesh them out a bit. And today and tomorrow is the final big show where they get down to the nitty-gritty on writing stories about the stories, basically. And the whole idea is they will produce a report and send it up the line in the National Science Foundation management chain and come out with a solicitation, they say by August, but we don't know if that'll really occur, to offer to fund prototypes for these various use cases that they end up thinking are important. And today was the presentation of the use cases from Brian did a masterful job of presenting a consolidated use case on community care, which he'll tell you about in a minute. And we did another one on NIEM, and another one, the criminal justice one was integrated with the community care presentation that Brian put together, but also was separately discussed by the Bureau of Justice Statistics. And the NIEM proposal for an ontology went forward. And I can tell you from talking privately with National Science Foundation, they're very excited about all of these use cases, and whether they'll end up in the list, the final list to be funded, is still up in the air, but I'm pretty damn optimistic that a bunch of these are going to get serious consideration, thanks to all the people that worked on these things and you know, help put these together. I think we're in a great position to get some funding to move forward with these ontologies and creating some prototypes. So that's kind of the background, and that sets up Brian now to tell you more specifically what he did today in a masterful way to provide a totally integrated notion of community care. Brian?
Oh, you're going to make me blush here. What we did was last week we had an Open Knowledge Network, an OKN check-in workshop. It was to kind of do our last work in fleshing things out. And a group of us, specifically Sonia Kim, Samuel Klein from MIT, myself, and later on, Dr. Erica Smith from the Justice Department, kind of put our heads together and said, you know, all of our stuff is kind of interdependent. Rather than doing what NSF wanted us to do, which was to each use case give an 8-minute pitch about how wonderful our use case was. Let's just skip ahead in a process and give a single consolidated presentation about how all of our pieces could fit together, because that's what NSF is planning on doing anyway. Let's give them a real live demonstration of how our particular use cases could play nice in the sandbox together. So we did this presentation. I have to tell you, Sonia and Sam and Erica were wonderful. They each worked late into the night. I think I was up until 1:30, and I got an email this morning saying from Erica at 1:33 saying she was just starting to work on things. So we were all living on coffee today, but we managed to pull together a presentation that should run about 24 minutes, you're full warned, but only if I skip lightly through a lot of these slides. So feel free to say, whoa, I need more detail on any of these. But this presentation incorporates 5 different use cases, 6 if you count decarceration and reunification as separate ones, plus homelessness, plus the integrated justice platform, plus consent, a consent service utility, plus the name ontology work. And we threw in a call out to the compounding disaster / events use case, just to cover the rest of our bases. So, what is this? I'm going to skip over this. I've already talked about the first half of this slide. The intent is through integration and interoperability between these use cases, we can monitor community, family, and individual needs, deliver community-based healthcare and social care services to meet those needs, provide analysis of investments in the well-being of vulnerable populations to prove that, in fact, those investments have been worthwhile because look how much money we're seeing. The result is improved community health and well-being for all members of the community. In consideration of our various use cases, we found it useful to think in terms of our Project Unify, somewhat complicated user story. And this user story is the Sarah Thompson decarceration and reunification user story that we've talked about in the past. But for the new folks, I'll give a very quick overview. The user story, which is documented in our user story catalog, is Sarah Thompson gets arrested, detained, convicted, and jailed for child endangerment and DUI after her 10-year-old son Jameson is caught using her prescription medicines, and she subsequently crashes her car while under the influence of opioids. Sarah loses custody of Jameson, and his younger sister Madison is evicted from her apartment for non-payment because she's in jail, and is fired from her job when she isn't able to go to work. Before community care, on release, Sarah would be returned to the community without housing, job, car, or her children. Sarah would face long lead times for getting access to services and wait lists for housing. But there must be a better way, the community care way. And you can't tell it one time I was at VP marketing.
Keep your day job.
And by the way, we did choose community care because we were trying to figure out what could we find as a bandwagon name for this group that wasn't specific to any one of our different use cases. And I suggested community care because it kind of paid homage to social care and healthcare. And we even went so far during our discussions with Erica Smith in the Justice Department.
Nitty gritty house cleaning work, as far as I'm concerned. And I'll hang in there for
Hang on a
most of
second.
it.
Let me mute Paul here.
No, don't worry about it. Don't worry about it. I'm sure Eric will be there as much as he can, and I'll be there just to gather intelligence mostly.
You succeeded. There we go.
You're back.
We even, in discussions with Erica from the Justice Department, even considered coining the term justice care. She loved it. She loved it. But it was a little over the top, even for a former VP of marketing. So
All right, I'll keep you posted.
he's back.
He's
All right,
back.
take care. You too. Bye-bye.
All right, one more time.
Under community care, while completing her sentence, Sarah takes a prepare survey to determine her post-incarceration needs. Based on the results of this survey, a decarceration plan of action is made for her in collaboration with a homeless services continuum of care case manager. The survey identifies her need for work, childcare, food benefits, and stable housing in order to rebuild her life and regain Jameson and Madison from state-mandated out-of-home care. The decarceration plan prescribes a series of services and benefits that Sarah will need to successfully return to her community. The plan also defines milestones for notifications of Sarah's planned release date and actual release. The Department of Prisons or County Jail will send those notifications to the local continuum of care case management system. The case manager assigned to Sarah will use that system to send referrals, including her expected release date, for temporary housing in a local homeless shelter for the day that she gets out, community and state public housing when it's available, community or state food benefits, job training services, job placement services, and transportation voucher benefits. By proactively submitting referrals to social care agencies before Sarah's release, we can ensure that services and benefits are applied for on her behalf to shorten the time between her release and the availability of food, housing, career training, and transportation. These simple steps to support released prisoners enable them to return to their communities with the supports they need to reduce the chance of reoffending due to pressure to survive. But each of these different systems holds information that Sarah would consider very sensitive if inappropriately shared. So, in addition to the challenge of sharing across siloed information domains, each with its own protocol standards and its own ontology for data models, we need to overcome the problems of gaining and transmitting consent for the exchange of necessary information across environment systems. And then we gave an example of some of the potential interfaces. This was from the homeless group. We got into the decarceration scenario, which we've covered for the most part just in the overview. So I'm not going to bore you with the gory detail. Again, here's that pretty picture with the same basic messages associated with them. The community reunification. The message on this one is, you know, we're talking about reunification of families within the context of Sarah returning from prison and hopefully getting her life back in order so that she can have her children return to her. But families facing housing instability, food instability, job loss, often risk losing their children. So, you know, this is a challenge that is not just associated with incarcerated individuals, but individuals who are at risk losing their homes, individuals, family members, heads of household that are homeless, those that have had other kinds of financial and or justice setbacks. So this kind of housing instability can lead to loss of children to foster care, or in the case of Sarah's case, delay of return of the children to Sarah from out-of-home care. So, timely notification of family unification housing choice voucher eligibility can significantly improve a family's ability to attain and retain stable housing. However, timely eligibility notifications are impeded by the lack of interoperability between the differing data systems of these human services organizations. The ones involved in this particular use case are the State Children and Family Services Agency, Child Welfare, and the U.S. Department of Housing and Urban Development, responsible for the Housing Choice Program. As this lovely diagram shows. The decarceration plan, in combination with the local continuum of care housing, homeless management information system, prescribes the HUD housing choice voucher program for Sarah. And it involves interaction with child welfare, the foster care system, the family court system, and of course the public housing system, all of which need to be able to exchange information in order to be able to ensure that Sarah gets the housing that she needs as quickly as she possibly can, as one part of the service plan to get her back together with her children.
Hey, Brian, can I interrupt for 1 second?
Sure.
Take a minute here. Two questions here. One is, this sounds like there was a lot of discussion amongst the various use cases to sort of integrate that, as opposed to just sort of slapping it together. So was there a lot of conversation in terms of putting these slides together as you've been moving through the last couple of meetings here?
Well, keep in mind that the bit that you've seen so far is really just Eric and I working together on
Okay.
restoration and reunification. And we spent a lot of time even before we submitted this to the NSF back in, what was it, all February?
Mhm.
When we initially got this started. But we've also been doing 6 months worth of work on this, or 5
Right.
months worth of work on this since then. However, what we're about to get into here is where we start moving into the integration work between ourselves, the Integrated Justice Platform group, the Homeless Platform group, the Disaster Services group, the New Ontology group. So there has been, the last few days have been rather intense in terms of negotiations, discussions, alignment. And I'm very, very proud of our little group that we were able to make such tremendous progress.
And you should be, Brian. You really did a great job of pulling us together. But one of the
We all
reasons
did a
that
great job.
one of this reason it made a lot of sense, Daniel, is that Brian and I and a few others realized that the National Science Foundation has a big appetite. In effect, they want to boil the ocean.
Mhm.
So the closer we can get to that, the more likely it is they'll provide funding. So
Right.
what Brian's done here is put a package together of these things that, makes sense actually. And it does, I made the point to the whole group that if you put all these communities together that we're addressing in here, it represents 40 to 50% of local government budgets.
Wow.
So you're talking about something that has an absolutely enormous impact on state and local agencies throughout the whole country. Excuse me for interrupting, Brian, but I wanted to
No, that's quite all right.
congratulate you.
So this is, I'm not going to get into gory detail on this one. This is not my use case, but the Integrated Justice Platform put together has been working on defining a use case in which their number one objective is to get data-driven strategies, not only for operations, but also to learn how different individuals move through the system and determine what kind of support they need. Of course, 2 is looking for bias and inequity in the justice system, and as a consequence, improve policy intervention. The 3rd is to build in support for ethics and equity as a central focus to justice, and to make the U.S. criminal justice system a little more transparent. Now, the reason that we're interested in the integration between community care and this justice platform is that we recognize that in this particular user story of Sarah Thompson, there is an entire thread that runs through poor Sarah's life from the time she gets arrested, not just through the time she gets released, but the time that she is on parole and the probation after her release, in which we need to get social care and health care involved in helping her do a better job once she is released, actually be properly reintegrated in with her community, have the necessary survival needs met for her when she gets released, as well as have those tools that she's going to need to rebuild her life, and as a consequence, prove to family court that she is worthy of having her children returned. And an important aspect of that is not just the integration of the justice personnel and the social care and healthcare personnel, but also being able to track the resulting outcomes for Sarah. Have the social care and healthcare interventions that were provided to her, starting from when she took that prepare survey while she was in all the way through to when she was finally reunited with visit children, have they been successful in helping her rebuild her life and not reoffend, which of course is the #1 goal here. We're not interested in punishing people. We're interested in rehabilitating people and making their lives better. So I think I've gotten a little ahead of the presentation here. I'm sorry about that. But yes, this is the use case narrative slide for this. And the next slide is, now we're getting into the homeless slide, basically pointing out that just as with justice, we have an interest in integrating social care, healthcare, homeless support, continuum of care support. Now this was Samuel and Sonia's presentation. Sonia, do you want to say anything specific on these slides, or shall I just zip through them in the interest of time since they're not unified?
Specifically on homelessness? No.
Okay. I wanted to give you the opportunity because I don't know this particular area well, but I am so pleased that you and Samuel kind of integrated in with the rest of the presentation. As you can see, Sam even grabbed a hold of our pretty picture and modified it and dumped it in there. But the approach that Sam was taking was, you know, there are mechanisms that we can put in place to help solve homelessness. It's a chronic widespread problem, but it is also easy. It costs more to try to address the side effects of homelessness than to solve the homelessness problem. So why don't we do that? That one way that we can do this is through improved information exchange, improved APIs to help with reuse of current efforts that are going on out there in many different communities. And also to improve the dashboards and visualization mechanisms that are involved for helping to surface the homelessness problem, identify potential countermeasures, and integrate the various participants in a local homelessness response. And here's an example of some of the tools that Sam has been working on. Or working with, I should say, since he's pulled them together from multiple different places.
There are a bunch of tools that are available that we actually identified. So some of it is actually freely available for use.
What kind, if you could just say a few words about what kind of tools you're referring to here, because it's a little hard to.
Some of
to
them
piece out.
are like heat maps that sort of pinpoint where homeless encampments are. Another one is it's a crowdsourced tool for, I believe it was housing matching, if I recall correctly. Mm-hmm. I'm unfortunately on my cell phone, so yeah.
There was one that showed where shelter, food, and other services were available. I think that may be the one.
Yeah, I think it was Shelter Point, that app, and I believe it's on the right hand side. I believe that's the crowdsourced app.
Yeah, we're looking at it now on the screen. It's Shelter app. So so there are various and sundry other dashboards that are available, and they all appear to be, a lot of them appear to be open source or really usable. So this group has done a really great job, and it would be lovely to see them funded. Of course, integrated in with community care, but
right.
So one of the things that I think we all finally identified with is that the kinds of services that we're talking about providing to homeless individuals, to folks that are being decarcerated from prison, or families that have been broken apart and need to pull their lives back together to be reunified, are exactly the same kinds of shared services that someone might need for a population that was vulnerable after a disaster. If you've got, you know, a hurricane and a flood that hits New Orleans, you're going to have a number of folks that are displaced from their houses that need to have housing, that no longer have access to the food that they had in their kitchens, and probably no longer have access to grocery stores that have been flooded out. They're going to need food. How do we get them transportation if their cars have all been knocked out? Either to be able to get around the city to help rebuild the city, or just to get out of Dodge so that they're no longer endangered by the aftermath of the disaster. So what we're asserting is that this community care concept has legs, that it's not just for incarceration or reunification or homelessness. It is for any environment in which you suddenly find yourself with vulnerable individuals, families, and communities, to help bring them the services and benefits they need to survive. Then we got into the consent services. I'm not going to bore you guys too much with this because I think you've all seen these presentations one way or another. This is the how do we deal with consent for information that's spread all over the place. Well, one solution is to provide a common consent utility through which one can gain access to the consents associated with each of these different systems, through which you can manage your consents as an individual, or manage your consents as a case manager, or gain access to those consents as a system that wishes to exchange information with another, or reshare information that has already been exchanged, but do so with proper consent. This is the critical slide, the last slide in this particular section, but this is a re-envisioning of the LEAP CBS architecture model. If you squint your eyes really tight, for those of you who know the LEAP CBS model, you'll see that we still have the consent enforcement service called authorization enforcement on the left-hand side. We still have the consent decision service. I've been a little clearer with it. It said it's computed authorization service. And we still have the notion of a consent discovery service. That is something that goes out and keeps track of. Where do I have information that's sensitive, and where do I find the consents associated with that information? But we've done a couple of things with this. Number one, we've moved the end user consent management around so that it's making use of consent discovery, so that the end user consent management doesn't need to know where consents are a priori. It can find out where those consents are on behalf of the individual that wants to manage their privacy preferences and consent. And we've added in identity management, identity matching, record location, et cetera, which were implicit in the LEAP CBS model, but not explicit. So all of this in a bigger presentation, I've broken out into individual slides for each of the lovely blue boxes to do a deeper dive into what technology exists that we can potentially use for implementing that. And this is very much a draft presentation, so it is not yet complete. If anybody wants to sort of throw in with me and Eric and a few others, I'm more than happy to have the additional help in figuring out where we document the different technologies. On community care dependencies, all of this is, to repeat myself here, based on multiple different OKN proposals that were floating around out there. And also is dependent upon the meme ontology and another use case that we haven't talked about here, the collaborative knowledge network, which may or may not be true, but I felt it was important to, to do a shout out to yet another one of our colleague our use cases in the workshop. Sonia, do you want to talk about the last few slides here?
Yeah, sure. As far as the natural fit for all these use cases, I mean, they're all part of the same puzzle. It's same, they're all pieces of the same pie, which is basically community services. And then the need to make them interoperable, make the appropriate sets of data available for researchers and whatnot. And so the issues of developing a collaborative like this that exists is that right now what we have is a de facto setting where it is a software-based means of interoperability. So if we're trying to coordinate, any number of agencies within a community to be able to share information, do data analysis across all the different software in question, we need to figure out a alternate method. And so the idea of taking knowledge graphs and the OKN network and then superimposing that whole framework idea. So what we're doing is we're essentially shifting the idea of a software-based method of interoperability to a framework. And so the framework would be the OKN network, knowledge graphs, and then connecting all of those data sets, and then also including standards like NAME, which would be the ontology that would connect all of these different data sets together. And so really what we're proposing is a pretty sizable shift in the way that that communities, and for that matter, any organization would pursue interoperability, whether it be for analytics, whether it be for reporting, or from a operational standpoint. And so we're really hoping that the NSF, I mean, when we presented, the NSF was very responsive to the fact that we actually sort of mashed up all these user sets or these use cases. And so I think it sort of is in line with their thinking of developing this OKN open knowledge network. And obviously there's a little bit of a difference in that what they really are after is open data. And so for this particular set of agencies and the data that would be associated with that, not all of this data is going to be actually, I think it's not responsible for it to be open, but at least we are getting to a solution that would move us in the right direction. So I think
We have, you have another slide in 2. Let me zip over the NEEM ontology because Eric's going to talk about it separately.
Yeah, and I'll let Eric speak to NEEM about NEEM since he.
So I think you talked about a good deal of this already, but go for it. This is another one of your slides.
Yeah, I actually just included it as a demonstration of the shift, as I said, from a software-based method of interoperability as opposed to the framework that we would be actually building. And then NEEM would be an integral part of that, right? So it's going to be software independent, platform independent, meaning that any organization, we basically meet them where they're at, using their legacy system, using the NSF NSF knowledge graph framework model, and then NEEM as the ontology that would actually connect all of these data sets together, bridging all the language barriers that exist as far as the ontologies for each different sector.
Apologies. I have an earlier version of this before you updated the last slide here.
Brian, Jim is asking a question about RESTful APIs.
Hang on, let me pull it up.
Are you referencing RESTful APIs? Jim, I'm not sure if you're referencing.
So actually, the question is really more towards Sonia when you talk about more than just APIs. Are you talking about a framework that's a bunch of RESTful APIs that point to the different entities that are either asking or providing some kind of consent?
I actually think that Eric might be a better person to answer that.
All right, well, whoever. We could just table it for later on, but it would be interesting to understand from a framework perspective the general approach, especially since most countries consider consent a contract, and often, as I tried to point out this morning, that contract is one of adhesion.
Can you guys hear my audio okay?
Yeah.
Yeah.
Okay. Yeah, I think that would be the end goal, Jim, is our RESTful endpoints for consent. Mainly what the OKN has been working on is at the model level. But I think that most of the interactions will occur, if not necessarily via REST, some sort of HTTP, communication, whether it's, RESTful or GraphQL or something like that. But that will be how the endpoints are accessed. But key thing they're working on right now are the semantic relationships between the concepts from which the software can be modeled. And then what flows from that are the RDF representations of the linked data representations of the objects. And then those could be represented in many different ways across many different tools. Once you have that, there are tools that convert linked data to RESTful structures. There's other ways of going about it. But yeah, I think that's the objective, Jim.
Okay, thanks.
So anyway, this was the tail end of this particular presentation. The feedback that we got both publicly and privately from NSF folks was one of delighted amazement. It's the best way I can describe it. I was a little worried that they were going to be a little crusty about us going outside of their process for doing this, but on the contrary, they were absolutely delighted that we had gotten with their program and had thrown our lot together in defining, in essence, what they were describing as a prototype OKN around the concept of community care. And I, at the beginning of last week, before we had our check-in and et cetera, I was feeling a bit pessimistic about the chances of decarceration and reunification being funded. I have no doubt that consent would get funded because we keep seeing the requirement for consent pop up again and again and again in the workshop discussions. But the decarceration and reunification use case, it's a challenge to meet the needs of an individual. Even with the rosiest colored glasses on, well, maybe it's helping with a community health and well-being problem. But it's not addressing what one could argue was a nationwide problem that gets solved with each and every transaction. On the other hand, it is a nationwide problem. It's just one that happens to be associated with individuals rather than entire populations. So I was looking at what we were doing as important work, an important duty to perform, but not necessarily something that was likely to get funded. With the 5 of us having gotten together and said, here's a vision. here's how community care works, and here's how it applies to multiple different examples of use cases. Now, I feel like we're dealing with something that really does have the legs for being a national level funding program. And it all depends on what other folks come up with as potential solutions.
So Brian, I was just going to ask a quick question about what you expect them to come out with. Do you expect them to come out with a kind of a coordinated community care request, or is it going to be more granular or siloized, do you think, at this point?
We don't know.
Okay.
The process that we had today was supposed to be individual use cases making their last fervent pitch. And then this afternoon, we had a process in which we broke up into little groups and talked about how we would create a proto OKM. In other words, what we did already with community care.
Yeah.
The group that I was in, there was insufficient focus from my point of view to really talk about what major problem we'd be solving with the things that we all threw into the bucket. It was like trying to make paella, but or a good stew, but instead of having a nice group of different kinds of fish, one person threw in a rutabaga, somebody else threw in some clams, somebody else threw in a side of beef, somebody else threw in, it was not going to be a delicious dish. And I don't know if the other 8 or so, the other 7 or so breakout groups did better than we did. But the experience this afternoon I was in breakout group 5, or on with me. I was not impressed with what we came up with.
Well,
I think it makes the community care concept all the more valuable to NSF. It all depends on what their own experts decide they want to do. And they have their own people. They have their own people who are making decisions, coming up with ideas. They're brainstorming trust. They could decide to do something completely different, but has nothing to do with anything that we came up with in the last 5 months.
I was in a different breakout group this afternoon. So I think Brian was in the design of the kind of broader OKN breakout group. And then there was a separate one on how do you develop measures? How do you measure whether that the design principles are meeting the kind of ethical values? It was quite interesting and productive. I thought there was some ideas that had to be duplicated, but I thought there was some good brainstorming going on, good questions and things being put forward.
Eric, I haven't given you the space to talk about the NEEM ontology work. I apologize.
Well, I think it's a different story than what we've been talking about today, which is, the OKN's, adoption of these social services and criminal justice and other, areas of domains of modeling. But the other side of the story that I think we need to talk about a little bit is NEEM's preparedness to go in this direction. It's got it's got a decidedly historical document-based model right now, and it has limitations and it has existing implementations. So how do we go from that to something that the OCAN would be interested? How do we go from what they have now to something that could feed into a public, Wikidata offered aggregate or de-identified set of open knowledge for people that is semantically tagged and ready for consumption by anyone and everyone? It's open. And that's a big leap. And on one hand, Neem has a lot of work to do on its own to get up to that level from where they're at right now. They've done a lot, and they kind of been mirroring what the OKN wants to do in a microcosm, but over the years with their core ontology and the merging of the different domains common terms into commonalities that they see, and then getting them all to use that same term across the domains and bringing it into core, thus creating the harmonization they've been looking for. Well, the OKN would be doing the same sort of thing, but not just with Neem. There'd be other domains, with space biology and things that, that may be, far outside of, traditional topics that we deal with. And so, point being, is Neem ready to move in this direction? So a lot of the work we did, it was pretty exciting actually, because we had some of the people that invented OWL, were on the original committees of OWL and the original committees of RDF, 25 years ago. We had a couple of them who really focused on Neem. They really saw the value of having, a semantic model for Neem instead of what we have right now. We talked a lot about how do we go from this. XML schema was made to convey documents. It was made to mark up, technical documents people would read with illustrations and some structured text. And it wasn't meant to be a semantic model. And over the years, it's been abused by technology to become that. And so now how do we get it moved to a semantic model? And so we had a lot of discussions, Paul and I and Tom and Catherine, Escobar, tried to broker discussions with NTAC and these technologists in the OKN about how are we going to go from what we have to where we want to be. And where we came a long way over the months. At first it was, how do we make round trippable models? Do we have this common model framework and then get it into an OWL framework and then go from there, or what? And we pretty much came to the conclusion that pretty much incompatible. A tree hierarchy-based document model like we've been using can't handle and isn't flexible enough to round trip with a real graph model, and where anything can be linked to anything else, and you have a lot of differences. XML schema was meant so you could check that everything is in its right place. Well, knowledge graphs aren't like that. They kind of don't deny the existence of anything. They just let it exist and then just kind of change to adapt to reality. It's an open world, assumption model. Whereas Neem had been kind of working in the, look, is this a valid message or not? We'll check that it's got all the parts it needs, and if it is, good. If it isn't, reject it. And that's not how knowledge graphs work. They work more on the basis of, okay, here's some data. Does that fit what we have? I don't know. Well, maybe it does. Just keep it there, and let's keep evolving the model over time. If it's valid data to meet the reality. And so that's something that, Neem had a lot of, Tom did a lot of work looking at the tools for validating, checking that messages might have all the contents they would have without using XML schema. So we use something called Shackle for that. And they have some other tools too that you can take advantage of in the knowledge graph world. And we talked a lot about how we're going to add metadata like they use in Neem already. Data about data. How do we tag privacy and consent and things like that into messages? And with it's not easy with XML schema. It's quite easy with RDF and with linked data. And you just treat it like any other data. It's really just more data. And it's just which definition does it point to? So it was tough, but over the months, what we saw is, I don't know, through attrition or wearing people down or just getting them to understand the issues at stake, we got the technical people in Neem at the NTAC to understand what they're really asking for when they're talking about round tripping with a knowledge graph. And we pretty much came to the conclusion that this is going to be a pretty good task. We're going to have to use a lot of the existing common modeling paradigms that are out there in this knowledge graph world. And we're going to have to apply those. And it's not going to look the same as what we had with Neem before. We'll make it better. It'll be more flexible. It'll handle a lot more. It'll be more adaptable. but we're going to have to do it from the ground up, and we're going to have to do it separately. And this is actually kind of a recent, revelation where we got the lead technical people in NEAM to agree with these founders of RDF that, yeah, this is a good path. We can get behind this. Let's go for it. And that was exciting because now we've got, the knowledge graph practitioners seeing a path for NEAM, and in reverse, and I think this is more important, getting the people who are supporting existing legacy running production operational NEAM to understand a path for NEAM that isn't just continuing, along the same lines of business as before, and moving into this new world that has increased capabilities for AI and introspection and inferencing and just not even knowing where it'll exactly lead, either operationally or analytically. And so that's what I think has really come out of this. And Paul made the observation, yes, NSF, the OKN, very important, great opportunity. But what we've come up with now are permanent linkages with the knowledge graph community, the leaders of that world. We can take this and build on it across many different, funding streams and opportunities. And I think that's the most important thing that may have come out of this. Even perhaps more important than funding over the long term is just a paradigm shift and an acceptance of knowledge graphs as a future of where we're going with information exchange. And hats off to Fire. They started with an ontology representation. I think they could beef it up a bit more and work more to connect it with these knowledge graph dots. But there are a lot of people doing that already, and I think this is great because now we're bringing the human social services world and the judicial and the criminal justice world in line with best practices in data modeling. So that's where I see it, and I think it's just been a really exciting journey.
That's amazing, the development. You guys have been really committing the time and resources to make that sort of push it ahead. One question in terms of, as we think specifically about consent, and we'll wrap up in a couple of minutes here, but as we think about consent, can you draw sort of a parallel there? Because and I know that Brian we've talked about this a bit already, which is there are so many places where consent might be needed, whether or not it's in education or juvenile probation records and healthcare, behavioral health. Draw for me, if you can, a parallel to graphs and consent. Is there a connection here that we can put our arms around?
It depends on which area. If you're talking about consent for putting someone's data into a graph that's somewhat private, there's controlled access to it. That's one area that these consent calculators that Brian was showing diagrams, for Unity could do the processing for that kind of markup, the tagging of that graph data. For public knowledge graphs, yes, perhaps consent to be aggregated, included in aggregate numbers. I don't see it. Right. I can't think of a great use for consent to publishing personal data, on public knowledge graph. But crazier things have happened. But I mean, there are people out there who don't care about their data being shared, and they'll just put it out there, and yeah, it would accommodate that, of course. But I think more, there's definitely a tension between NEAM's primary use as a operational information exchange platform and the OCAN's focus on getting this all tagged up and linked up to Wikidata, Wikipedia's linked data set. Everything you edit Wikipedia today, it'll get transformed overnight or sometime soon into linked data, and that and then that's machine readable. And so that's where they're going with this. It's going to have that happen to it. So yeah, consent. It would be some sort of where Dr. Scott really focuses a lot on the when we talk about conversion to a semantic knowledge graph technology. He talks a lot about the markup of consent and privacy. Also, Department of Defense uses NEAM and such, and so they have their own purposes for that as well. More fine-grained security markup, but and also privacy markup. But like I see, yeah, there's there's a lot of overlap, and it's just a complicated topic, but there will essentially be a knowledge graph model of consent that will need to be
Mhm.
built, for any of these tools we're building, and then that will have to be implemented in code, and then how the data is stored would reflect that model as well, with the the tags and the markup for it. It's just like we've been using in some of our just kind of ridiculous examples where we talk about how we would go from the existing NEAM XML schema structure to a web ontology. We've been using this example of Harry Potter, and we just use privacy true or false boolean just to make a point of how it would go in there, and we all laugh and we all know it's not going to look anything like that. But it's the point of, it's this extra data, these extra structures slapped into the knowledge graph, and then access to the knowledge graph is controlled, depending on who you are and what you're trying to do and your context and your role and all that. So it'll be complicated,
So
unfortunately.
it's not so much, Eric was making a joke about true or false and that being very simplistic in regards to consent. It's not so much representing that yes or no consent. Knowledge graph is important to representing yes or no, something as simplistic as that. It is the fact that each of these laws refers to a type of data within that domain, and that data is represented differently across different domains. So not only do you not have a universal way of representing consent as a concept across sectors, you don't have a common way of representing the data to which the consent is being provided. So that's where knowledge graphs could be impactful, if you had a knowledge graph that was addressing the larger interoperability issue around how does education represent this type of data that's regulated in this way, and how does healthcare represent that same data. So that's where like all the bells and whistles of knowledge graphs become important or impactful.
Yeah, and I think that's a key point, is that there isn't going to be one knowledge graph, right? There's going to be many, and access to them will depend on what you're trying to do and who you are, and that'll be interesting. But yeah, what the OKN's talking about is definitely one big, maybe not one single like hosted one-on-one database, but the point being, it's one large interconnected open knowledge network of data, and so that's going to have its controls and more about how the data is processed before it gets dumped into it, because once it's there, it's public, right? It's anybody can have it, and so that'll be interesting as well. But that's for them to figure out. I mean, well, actually, that was one of the topics that the breakout groups focused on, is well, how is your data processed and what are the rules before it can even arrive into our OKN. And to me, I don't know. I mean, honestly, I'm more about operational data sharing than I am about big aggregate data sets or de-identified data sets. But I see the need to get into that world if you're going to find funding for good modeling that's interoperable and then allows for interoperable messaging.
I was going to say, Eric and Matt, there's there's quite a bit around personal data processing, specifically around notice, advanced notice, and then prior notice, that the data protection officer, which is a very much a GDPR term, a data processor and a data protection officer, which are required under the GDPR. But I know there's a lot of work going on in the CCPA. I can't speak around the privacy laws that were recently passed in the state of Utah, but I know New York, being from New York, living here, has a bill up that actually goes as deep as requiring companies to expose to individuals who share data that's de-identified, so it's autonomized, exactly how they do it. And I don't want to I know we're at a very high level, and I don't want to talk too much deep down in the weeds, but if you have a chance and you kind of like to buff up on some of this stuff, this is a very good link that I think will help, because it goes back to the IAPP, the International Association of Privacy Professionals. A lot of them are attorneys that work for big companies, and they turn around and more or less tell the information services systems, what some of us with lots of gray hair used to call the MIS department, exactly what they have to do in order to be compliant. So it might be helpful, but I think you guys are definitely going down the right track on all of what you're putting together.
Thanks for the link, Jim. It's excellent. I've been scrolling through it.
Hi, also, this is Courtney from US Aging, and I have to say I've already communicated with Brian offline and told him I have about 1,000 questions. I love the presentation. It's got so much to it, but there are a lot of questions, and I think the multi-domain consent is huge. I think some of the things to contemplate, do these various agencies and players even have the capacity to scrub, modify, and transfer their data? You know, I know underfunded networks, that would be very difficult for them because they don't even have that capacity to then transfer that on, as well as, do they even own their data? There may be places, I know I can think of one state amongst our network where the state owns the data and gets to decide what does or doesn't happen. So there's some, what I would perceive to be speed bumps along those ways. The other thing is, and I've put this to Brian, and I appreciate his big brain and trust him to help guide me there, is for a network like ours, we're interesting because once you get to a AAA, we have the capacity to help with rides, transportation, elder justice, whatever it may be. So we're a little different than everyone else. So I'm curious as how these things would fit for an entity like ours, and I'll acknowledge our network is very different. But a lot of questions here because this raises so many wonderful opportunities, and would love to understand more. So thank you. I've left you all speechless.
Well, I can't say anything. I'm blushing too badly.
You know, I was going to actually say for our call next week, we may want to reprise parts of this. There's a lot of good questions and resources here. I'm hoping that we'll be able to use some of that time to, or use the time to think about the consent workshop. By then, I'm sure there will be more communication. How this gets built into that, if there's an opportunity for it. Again, we're not quite sure what the structure is. Courtney, I'm not sure if I mentioned this or you heard this last week, but one of the things that ONC told us was that they wanted to organize the presentations by sort of life cohort. So from children, and they actually had aging in there. So they've been hearing whether or not it'll be addressed in this particular workshop is a TBD, but they're thinking about it in those ways, which I think is really interesting. And again, if I'll hear more Friday when we actually have a little deeper dive conversation with them about what they're expecting from us and from Unify and from the consent group here. But you know, it might be this NSF work might be actually a topic that is interesting, especially since it's, you know, this integration, right, Brian, where you've got all these different, you know, and healthcare is not in the middle of this, which is interesting, right? Healthcare is sort of like, you know, out in the ante room. All of the groups that are there are sort of the proverbial edge cases, one might say, from their perspective. So to actually sort of reincarnate that could be of interest, actually, as a particular way to think about it. Again, I'm not sure, but it's something to keep in mind as we're talking to them and see how we integrate this, continue to move the work forward, albeit saying maybe we dive into some parts of this and answer a few of the 1,000 questions, Courtney, next week that we may want to reflect on a bit and get a little closer to the answers around.
Just to blow Courtney's mind, how about think about one of these, free graphic pictures that I showed. But instead of having a continuum of care case management system at the center, it's a AAA. And dealing with all the same problems we talked about.
Well, I have to admit that occurred to me, Brian. And what's interesting is I know, our folks already are doing a certain level of consent with their downstream providers, because as a reminder, and for those of you that don't know, our 620 agencies and our 220 Title VI's contract over 18,000 local aging service providers. So they already are managing information flow, consent, waivers with those folks. I'm guessing some agencies are so small, underfunded, and unsophisticated that they're probably sharing those things by fax. But for most of them, they have some type, and that's to let you know the wide range we have, from uber sophisticated to very, very underfunded and unsophisticated. But I'm sure the majority of them are doing that digitally. Is it done efficiently? I can say for 95% of them, probably not. So any model that advances that is great. But Brian, yeah, I thought about that because of the numerous players that they touch. I mean, I was interested to see you put this disaster response up, because our folks are very used to dealing with disaster response, because the folks who tend to be neediest in a disaster are older Americans who are at risk and children who are displaced. And, we have horror stories of older Americans stepping forward with a fistful of pills, and that's all they've come out of the tornado, the hurricane, or whatever it is with, and that's it. So, it becomes interesting.
Now, all of this quiet is going to give Courtney a complex.
Well, I will encourage you again to sort of put this in the center of the plate, Courtney, when the time is right to dig into the various pieces here. But I think you've given us a lot to think about, and certainly great work. And as I said, let's reconvene and reconnoiter once we get a little bit more feedback from ONC and see what and how we can sort of repurpose some of this and to keep it moving ahead as we think about consent and interoperability and data sharing and Unify and all those other good things. So with that, unless there's any other comments, I think we'll close out today's call. We'll convert this to YouTube and put it up on the Nick Hub for those who want to listen again or pass it along to their friends. And I want to thank everybody for coming today, as usual. Amazing conversation and great knowledge here. So you all have a great rest of the day, everybody, and we'll see you next week. Okay.
Bye-bye.
Take care, all.
Bye-bye.